Hi everybody. I wanted to just go over a few things that I thought might be helpful for clarification purposes. I wanted to pull up the course schedule and highlight something just to mitigate any future confusion. So with the schedule, the way it's written, if you scroll up to the top, it says reading and other material. And what this is referring to, and I realize that this actually is not very clear. So I apologize. And it didn't come until students kind of brought this to my attention that I realized where the kind of murkiness is here. But what this is actually supposed to be referring to is the week's reading and the week's material. So it's not referring to anything that's covered on a quiz or an exam. It's just referring to what is going to be covered in that week. So for example, for quiz 1 on assignment reading chapter 3 only was specified, but here you see it says chapter 2, 3, and 11. So that could cause confliction, but what it's meaning is that for Thursday, for the lecture that is presented, because normally you guys would have you'd have a 2-hour lecture on Thursday in class with me. You know, that's how it was before COVID. And so that would be the reading that you would want to have read by this Thursday. But because your lectures are online, it feels obviously very different. But that's what it's referring to. So the quiz is only on 3, but you're responsible for knowing all that material for the course. So then as we scroll down, you can see it's a similar thing here. All of these chapters were to be read by Thursday. The quiz was only on chapter 16. You go down here again, 4, 5, 28, but the quiz is only on chapter 4. And then we come down to the exam, and the exam is everything that was covered in weeks 1 through 3. But these chapters 17 and 28, that was the reading for Thursday, September 24th. So I hope that that clarifies that that's how you read the this course schedule. And I apologize that I didn't make that more clear in the beginning. So these other chapters like 17, 17, and 17, they're you might have noticed that these are all repeats. It's a repeat of the Monday, Wednesday, and Friday. They all look identical, just the times are different. And of course, the people in those groups are different. So, but it's all the same thing. So review chapter 17 for lab, review chapter 17, 19, 28 for lab, so that's what it's referring to. So these chapters refer to what you need to review for lab. These chapters, have to do with the reading for the week. So, and then what's covered in the exam will be specified in red. So as we go down here to the next one, exam 2, that'll be weeks 4 through 8. So it won't just be chapter 21. So I hope that clarifies that part. And then I wanted to show you something over here real quick. This is a similar template to what I have created for you guys just to use to help you learn mounting and learn positioning and that sort of thing. But I'm going to pass this one out because I wrote a few extra things on it here and made it a little bit bigger. This is the mount you're going to use for your mounting proficiency. I'm going to give everybody a different stack of individual images that you're going to either glue or tape onto this. And then you can I'm going to give it to you in an envelope so you can try and fold it back up and put it in the envelope so the individual images don't fall off like in your backpack or something. I realize this is a little rudimentary and kind of arts and crafts, but I don't really know how else to establish this proficiency. And so that was the best option that came to my mind. Maybe someone will have a better suggestion for me. So there's that. I'll hand this out to the Fridays group and then next week to the Monday, Wednesday group. And I also want you to know if you ever want to get something sooner, I'm obviously at school every Monday, Wednesday, Friday. Usually I get into my office by 12:30 to 1, something like that. So if you want something sooner than your lab time, contact me and come to my office. My office is next to Gail's office. It's toward the end of the hall. So you can always come to my office, make an appointment to meet me there. Okay, and one last thing. I'm going to go back to the course, and I wanted to show you guys. Oh shoot, hold on. Sorry, I didn't realize that was going to happen. Give me a second. Okay, I wanted to go to this guidelines again. And you can rotate it up here. There's this little rotate button, but you can also print it out and have it. But I wanted to just review this because I realized that it might be frustrating to many of you that we didn't really actually go over this like in the lecture that I just mentioned for you to read it and then do the case study. So I apologize if that seemed like I wasn't giving you enough direction. So I wanted to just kind of walk you through this without being too detailed because it's has a lot of different segments. But the way you're going to look at this, so this is recommendations from the ADA, that's the American Dental Association, and it's our responsibility to follow a LARA principle as low as reasonably achievable. And so to minimize the patient exposure, they have these guidelines. And so you can see there's times that you can kind of look and say, okay, for a new patient being evaluated for oral disease, so this is a new patient to the office, this is a child with a primary dentition, this is a child with a transitional dentition, so this is a very young child, this is, maybe a 10-year-old, 6 to 12, somewhere in that range. This is younger than 6 generally. Adolescent with a permanent dentition, an adult who is either partially edentulous or has teeth, and then this is an adult who has no teeth at all. They're completely edentulous. So those are the categories, and then if you look on the side, it's a new patient, a recall patient with clinical caries at an increased risk for caries. So this is a higher risk patient. This is a recall patient that is a very low risk for caries. This is a recall patient with periodontal disease. This is a new or recall patient for monitoring of dentofacial growth or development and or assessment of dental skeletal relationships. So this is more young probably, or also somebody who's transitioning maybe from losing teeth or something like that. And then patients with other circumstances, including but not limited to proposed or existing implants, other dental and craniofacial pathosis, restorative endodontic needs. So different, just different things if they have pathology or if they have, any number of things that could be happening. It's kind of a catch-all. And so it says here, you can see clinical judgment as needed for a type of radiograph image for evaluation and monitoring. So this is guidelines. They're saying you must use your clinical judgment. The dentist must take every situation into account, but these are guidelines to help. So for example, if a patient doesn't have a caries risk, if they have had very few caries, you can see here that a recall patient with no clinical caries and they're low risk, posterior bite wings can be spread out 2 to 3 years. Now that alone can be very surprising to a general dentist who is very used to doing x-rays once a year. So if your patient says to you, do I have to have my x-rays once a year? I never have cavities. Then you might need to bring this guidelines to your dentist's attention because, they may not need to have x-rays. So sorry, my throat's getting dry. So this guideline is very important for you guys to be aware of and know how to use it. Okay, so that was, I believe, the last thing that I wanted to say. Please let me know if you are having trouble. You do just have to kind of read through it and get oriented. And then there's some extra things down here that kind of give some definitions. Positive historical findings, positive clinical signs and symptoms. So it gives you some information to think about in relation to whether or not they need they actually need x-rays if there's fistulas or evidence of trauma, that sort of thing. Okay, so I'm going to back out of this. And so those are the couple things that I just wanted to review with you guys. And let me know if you have any questions on any of that and if that helped with clarification. All right, thank you.